the Limpopo Health Department has confirmed that 3 people have died from malaria, while more than 500 other cases have been recorded. The department has associated the deaths to cross-border infections from neighboring countries. Authorities say most of the cases have been recorded in communities along the Kruger National Park, including in the Mopani as well as the Vembe districts. Let's explore this further now. We speak to Neil Shikwambana, who's the Limpopo Department of Health spokesperson. Good evening to you, Mr. Shikwambana, and thank you so much for your time. The last count says that the death toll stood at 3 and over 500 infections. What's the latest?
The context to that is that the figures that you've just quoted are actually figures from the 1st of April last year up until now, while we're looking to close the financial year now in March. That 554 and the 3 deaths. So we are basically still there, but what we are doing is that we are heightening awareness in our communities, because in Limpopo we've just received very good rains, and the rains that we've received could pose a risk of more malaria cases, because we know that the malaria-causing mosquitoes breeds mostly in damp in the damp environment. Hence, we are calling on our people to be vigilant.
So, Neil, I know you say that these figures are from the 1st of April last year, as you're about to close the financial year now. Are you able to break down for us in recent times how many cases have you had of these over 500?
So, like I've said, we can just average the numbers, but what we can be able to tell you as well in context is that this 554 is basically a reduction if you look at, or rather comparing it with the figures of the outer years, that is the previous financial year and the year before. Because in the previous financial year, we had a total of about 4,035 cases, where we had about 34 deaths, and then on the year before that, we had around about 2,000 cases where we experienced 29 deaths. So we think we are on a downward trajectory looking at this, but it's no reason to be complacent. Hence, we are calling on our people to look out for malaria. And one of the issues that I think I need to stress is that if you look at the 3 cases that we've had, the 3 deaths that we've had, happened in the Waterberg district, that is in Tabazimbe and Bilabila, and those areas are not known for many cases. So it could have been that when people there, maybe let's say it's easy for a person who resides in that area, when they experience symptoms, to take it light, to say maybe it's flu, it will go away. Hence, we call on people to say, once you experience flu-like symptoms during this season, regardless of where you are in the province, please rush to the nearest facility so that you get tested and treated accordingly, because malaria is 100% treatable, but the issue is that it must be detected early before it becomes deadly.
I'm going to get to some of that in just a moment, but I want to stay with what you're saying in terms of the numbers that we're seeing and what we've seen in the past. What would you say is responsible for this downward trajectory?
Look, we think probably people are heeding more our messages of awareness, but also we're not sitting on our laurels as the department. We do continuous surveillance of the malaria mosquitoes, or rather those mosquitoes that carry malaria. And after doing the surveillance, we target those areas which looks like there could be hotspots in terms of breeding those mosquitoes, and then we fumigate the households in those areas. Areas that those areas are those that we have already indicated, areas along the Limpopo River in the Vembe district, as well as the areas aligning the Kruger National Park in Gyan, Palabur, and also Zanin. Those are some of the hotspot areas where cases are actually experienced in their most. So we do fumigation that goes along with public awareness to say, for instance, people need to take their own precautionary wherever they are in the province. If you sit at night, if you sit outside at night, make sure that you have covered your body enough such that the mosquitoes don't access you. If you're able to use mosquito repellent, please do. If you're able to sleep covered with those mosquito repelling nets, please do. And also ensuring that those who are traveling outside the country to countries that could be malaria endemic do take the necessary precautions in terms of prophylaxis and so on.
And as a final one then, Neil, when you look at the deaths, as you say, associated with cross-border infections from neighboring countries, have you engaged some of these neighboring countries to also get them to do their bit on the other side?
Look, I don't think it's mostly that. It's because those countries might be endemic to malaria, just like we are endemic as well, and some parts of KwaZulu-Natal as well as Mpumalanga, because this challenge is not only unique to Limpopo. I'm sure that because we've got cross-border collaborations as well, we should have held an international malaria day where we would have involved our counterparts from Mozambique and Swaziland recently. So we've got those kind of collaborations, and I'm sure that doing their bit, just as our colleagues in KwaZulu-Natal, Mpumalanga, and all over the country are doing their bit to what we call. The issue is the nature of the weather, or rather the climate in these areas where these mosquitoes are able to thrive.
And as you say, also, as we've seen in some of the forecasts, there's some rains expected. But as you say, that people do need to take precautions. So if you do have flu-like symptoms, don't take it lightly. Seek some, healthcare assistance. But Neil, thank you so much for just putting us into context, especially as far as the numbers are concerned. Appreciate your time this evening. That's Neil Shikwambana, the Limpopo Department of Health spokesperson.